The problem of maintaining health worries every person. Despite the successes of the pharmaceutical industry, methods of disease prevention based on natural mechanisms of regulation of functional systems are popular in medicine. This is due to the fact that complete recovery from the most common pathological processes cannot be achieved with drugs. Nature has created man in such a way that he has an as yet unexplored mechanism for regulating biochemical and physiological processes. Human consciousness can regulate the state of immune defense, resist genome mutations, normalize blood circulation and heart rate. Modern medicine is symptomatic treatment. It is impossible to restore structural damage to organs and tissues with medications. However, numerous methods of Oriental medicine and health technologies that have existed for many thousands of years allow achieving unique results. This includes rejuvenation of a person, recovery from many diseases, including hypertension and angina, bronchial asthma and inflammatory processes. Modern medicine is symptomatic treatment. It is impossible to restore structural damage to organs and tissues with medications. However, the methods of Oriental medicine that have existed for many thousands of years allow us to achieve unique results. Among patients practicing Oriental methods of healing, we meet a large number of long livers. In such patients, it is possible to achieve complete recovery from hypertension, angina, bronchial asthma, chronic inflammatory diseases, and diabetes. But the most important possibilities of Eastern medicine are for cancer prevention and preservation of the human genome. Until recently, the mechanism of action of Eastern health technologies remained unclear. However, thanks to the work of such scientists as Petralbitsky, Barigo and Bora, Holden and Priestley, Buteyko and Bogomolets, it was possible to find out that the main mechanism of the health effect of Eastern breathing techniques is due to the unique role of carbon dioxide. The content of carbon dioxide in the body is regulated by breathing. Carbon dioxide is a unique regulator of metabolism, regulates enzymatic reactions in the cell, reduces the formation of free radicals that destroy proteins and DNA. Carbon dioxide is associated with acid-base balance and vasodilation. Today we begin procedures for eliminating deep breathing using Professor Pashchenko's method. Professor Pashchenko's method was used to prevent metastasis in cancer patients and to prevent cancer. But cancer patients often have concomitant diseases, such as hypertension, angina, heart rhythm disturbances. Professor Pashchenko's method is more convenient to use compared to Eastern health technologies and the Buteyko method. An important difference of this method is that it is personalized and can be used in any conditions. However, achieving health by this method can only be for those patients whose consciousness is directed towards finding natural methods of strengthening their body. For individualization of treatment, the change in the content of carbon dioxide in the body is carried out using numerous known methods of regulating breathing. The simplest and most effective methods of Oriental medicine are used. For some categories of patients, carbon dioxide accumulation methods according to Buteyko and Strelnikova are used. Elements of yoga, meditation, therapeutic exercise, therapeutic walking, fitness, and other health technologies are used. The main requirement for the patient to achieve health is the regularity and consistency of deep breathing elimination algorithms, which are offered during the procedures. These procedures are strictly individualized. To increase the effectiveness of chemotherapy in cancer patients, these are intensive modes that lead to rapid elimination of hypoxia and normalize blood pH. For patients with heart and vascular diseases, more gentle methods are offered, allowing even complex patients with pronounced pathological processes in the body to master the method. Metabolism is the basis of human adaptation to living conditions. However, neither vitamins, nor medicines, nor herbs and therapeutic fasting are able to restore metabolism in the body as it can be done by shallow breathing, which has been used in Eastern medicine for many thousands of years. However, each patient, with each disease, has its own set of metabolic disorders that need to be improved. Today we are conducting the first procedure for treating hypertension and angina. The 4th century treatise, Baoputsu, says, the beginner inhales air through the nose and holds it, counts to 120, then exhales through the mouth. Inhalation and exhalation should be done silently. A goose feather should be held near the nostrils, and when the skill reaches the level that the feather stops trembling, then the first stage of the art of breathing can be considered complete. At the next stage, the count is gradually increased until it reaches 1,000, and the practitioner notices that he is not getting older, but younger. But you need to change shallow breathing very carefully. Carbon dioxide is a strong medicine. And just like other medications, its increase should be strictly dosed. Today's algorithm for increasing the content of carbon dioxide in the body and gradually normalizing pH is effective for patients with hypertension. It is effective in patients with angina and heart rhythm disorders. Recommendations for the first procedure: first, throughout the day, try to breathe superficially, not deeply. Only through the nose. The mouth should be closed. Such superficial breathing slightly increases the partial pressure of carbon dioxide, which your body produces in the alveoli of the lungs, due to the inhibition of its release when eliminating deep, noisy breathing. Second, shallow breathing procedures should be performed only before meals. Third, in the evening before bed and in the morning, depending on the condition, you can arrange walks from 10 to 40 minutes. The main requirement for therapeutic walks is very slow walking, necessarily on superficial, shallow breathing. Fourth, if you want to take a deep breath, stop. You can sit down and not start therapeutic walking until shallow, not deep, not noisy breathing returns. You cannot walk and breathe deeply through your mouth. This is life-threatening. The main requirement is shallow breathing while walking. Usually, when using therapeutic walking, the condition of patients improves. Especially those who complain of pain in the heart area. Fifth, time must pass from the first procedure to complete recovery. Until the vessels are cleared of plaques, until the patient learns to normalize blood pressure independently, time must pass. Sometimes it is weeks. Sometimes months, sometimes years. Therefore, if the method has not yet been mastered, you can use the medications prescribed by your doctor. As the structure of organs is restored and metabolism is normalized, patients reduce the intake of medications. If you have started to master Professor Pashchenko's method, write your achievements and questions in the comments. The next procedure will be devoted to the method of increasing the percentage of carbon dioxide in the alveoli of the lungs. Today's stage is monitoring shallow breathing during the day. What happens in the body during the procedures? When deep breathing is eliminated. With superficial, invisible to the eye and inaudible breathing in the alveoli of the lungs, the content of carbon dioxide increases slightly within physiological limits. Carbon dioxide is a strong, natural regulator of metabolism. Physiological concentrations of carbon dioxide expand blood vessels, normalize the transport of oxygen by hemoglobin to tissues. In previous broadcasts on my YouTube page, you can see the mechanism of action of carbon dioxide and the Varigobor effect. Conclusion. The first procedure is the rules of walking for a patient with hypertension and, especially, angina. For those patients who are lying down, other algorithms for normalizing the content of carbon dioxide in the human body are used. If you have a patient who cannot walk, write in the comments. I will post a method for normalizing breathing for such a contingent of patients. In the next broadcast, a therapeutic procedure at rest will be given.